r/AskReddit by Reddit and chill. Doctors of Reddit. What was the most shocking case of I thought that was normal you've seen in a patient? My best friend is a doctor and he had a patient who couldn't move her arm but didn't even bother to mention it or seem concerned. He checked blood pressure and various routine tests. Then asked her to lift her arms to start doing some kind of neurological test. Oh sorry, I can't move my left arm at all. This is a disability you have had for some time, right? Oh no, just since this morning. Turned out she'd had a stroke. I'm guessing here that the stroke affected cognition and not that the patient thought it was normal. Still an extraordinary story though. During my short time as an acting physician at a hospital, a middle-aged man walked in. I took my checkup tests and he had testosterone levels at least 65% lower than average. When I asked him about it, he said that he thought all men felt like he had low energy, infertility, sleep apnea, etc. A lot of times the response to "I'm tired" is "me too." So I can see that. Not quite the same, but my anemia got pretty bad before I figured out most people aren't quite that tired. TLDR. Got what I can now conclude is tonsillitis several times a year without realizing it. Finally checked him out after they started affecting my work. My tonsils were rotten from the inside out by this time. My doc said, "How did you think this was normal?" Well, my parents never took me in, so shrug. Obligatory with me actually. My doc just said that exact thing to me pretty much. I thought everyone's tonsils swelled up several times a year, sometimes making it hard to breathe. Every time I got sick my mom just made me suffer through till I was better. Fast forward to when I'm an adult. One time it gets bad, so I finally go into urgent care only because at this point they're making me miss too much work. So I go in. The doc takes one look at my throat and this otherwise professional individual exclaims, "Holy shit, you need these out yesterday." Anyway, she puts me on antibiotics and I go into the ear, nose and throat specialist, but by then they're well treated with steroids and meds, so he doesn't quite understand the urgency. I have to give my boss enough heads up, so I decide to schedule surgery a couple months down the road. Apparently my body had other plans. 2 days after I finish the last antibiotic my body comes down with it again. Only this time I have body aches. A fever that won't dip below 103 even with fever reducers. And generally feeling like a hot pile of shit. They were completely rotten from the inside out and my body was probably hours away from sepsis before they got me on the right meds. Still had to wait 3 days for surgery because apparently there's only one surgeon in the area that takes my insurance and he only works 1 day a week. I'm recovering from surgery now. And I can already tell my life's gonna be a whole lot easier. Oh, and I can breathe while lying on my back at night. What a thought. Men. At least my mom was more aware. I was like that when I was a little girl. Getting sick like every month because of my tonsils. Until my mom, alongside our doctor, decided to take them out to improve my life quality. I don't remember the time when I had them nor the surgery. So when I was growing up I thought, for a while, that everyone looked like me. Until I was playing nurse with my sister. Made her open her mouth and realized that her mouth looked different than mine. I was like, what the fuck? I'm on the opposite end of this. I used to think it was normal when I would go number 2 in the bathroom my heart would race and I would break out into a sweat with my face turning bright red. My mom thought I was straining too hard. Saw a doctor and my blood pressure was through the roof. He suggested I had the symptoms of a rare condition. He was right. I had a tumor on one of my adrenal glands called pheochromocytoma. It got removed. I now poop normal. Was that the only symptom? Just extreme sport pooping? Former nursing student here. I grew up watching Bugs Bunny cartoons. And whenever I saw a close-up of the inside of the mouth there was always a large and dangling uvula, the thing hanging down at the back of one's throat, just like mine. So naturally I assumed everybody had one like that. Fast forward to nursing school and I began looking inside people's mouths and seeing nub after pathetic nub of excuses for an uvula. I'm like, what the hell is that? I suddenly realized I had a stalactite of a uvula in the back of my throat. Not my finest moment. But I officiated a wedding for my nephew. Well, not really, he's my cousin's son, but he's like a nephew. I got plastered off sunburns, 1 stroke 2 coconut rum incinerator aka fireball over ice, and on the way home had to hurl on the highway, and byway, and driveway. My uvula swelled to the size of a grape. A red, angry grape. It bounced around back there, kinda flopping in and out when I breathed, ate, or drank, making life miserable for a few days. My wife smiled a little every time I complained. She's sadistic, I think. I haven't touched incinerators since. And guess whose son taught his buddies how to make sunburns recently? He gets his sadistic streak from his mother. Not a doctor and it not completely related, but I was in the dentist chair and I heard an exchange from the next room over. 8. So why'd you come in today? Patient. Hey. Yeah, my teeth have been hurting and flaking off. 8. Well, let's take a look. A minute of silence. 8. Yes, it looks like you have a very large amount of plaque built up on your teeth. Patient. Oh, is that what keep flaking off when I brush? Cause I was worried it was my teeth falling apart. Brush your teeth daily, people. I have a weird teeth setup and unless I'm careful my bottom incisors will do that. Basically I will brush daily but not floss, and flossing is the only way to clean them. One day I had like an hour-long mental breakdown because I thought I had gum disease, but turns out it was just a piece of tartar that had fallen off and what I saw under was in fact my tooth and not my skeleton. Yes, I got my teeth cleaned. And I'm flossing to make sure it doesn't become an issue again. I'm a GP. A guy in his 30s was in for something different and while examining him I noticed that he moved his left leg differently. So I asked him about it and he said, oh yeah, I can't lift that leg. It's just osteoarthritis, and I was like, how, what? For the record, osteoarthritis is damage of the joint caused by wear and tear during someone's whole life. Very common in the elderly. So I examined his hip. And sure enough, he could hardly move it. Checked his file and talked to him about it. Years ago when he was in his late 20s. He had been seen for hip pain and the previous doctor had ordered an x-ray. Patient had called about the results and a student medical assistant had told him that the x-ray report said severe osteoarthritis. And apparently never notified the doctor. Patient googled it. Saw that there's not much that can be done about it except hip replacement, which he didn't want to do. And saw that it's usually progressive. But didn't see that it's something that happens slowly. Gradually. Over the course of one's life. So when over the course of the next years his hip just kept getting worse. He thought that was all just normal. I referred him to an orthopedic surgeon. But he still didn't want a hip replacement. So his situation didn't really change in the end. What was he to do? If he doesn't want a hip replacement, then seeing an orthopedic surgeon would just be a waste of time. Not asking for a consult here. Let me just give you an example. I'm in my 30s and have osteoarthritis in a different joint. I'm well aware that I have NSAIDs and my splint right now. Down the road my GP has mentioned hydrocortisone injections and someday maybe orthopedic surgery. It's not like there's a lot I can do about it anyway. So I've just accepted it. You might say it's learned helplessness. But there's really not much to do about it. Not a doctor, but a nurse. I was taking vitals during a routine physical of an older woman. Her pulse was fast and very thready. And her blood pressure was shockingly low. Normal BP is about 120/80. Hers was a mere 80/40. I asked her how she was feeling. She said fine. It turned out she had always had atrial fibrillation and knew about it but never thought to mention it to us. She was having an attack that day. I'm not a doctor, but I thought it was normal to immediately vomit food that you didn't like when you tried to eat it. Somehow, no one around me found it alarming that I immediately vomited every time I would try to eat a vegetable until my best friend pointed out that that's not a normal thing. I got a test as an adult. And yep, it turns out I have a rare and severe allergy to vegetables. Medical student. While chatting with a few friends who are fully fledged doctors and dentists, I heard about this one. Dude had not 1, not 2 but 4 extra teeth in his mouth. Now this isn't exactly super rare or shocking on its own. But when asked about it, he said, doesn't everyone have those? The guy was also a medical student that we knew. Granted, he was studying to be an optometrist, sorry, ophthalmologist. English isn't my first language, so it's out of his field of study, but still. My mom lost her front 2 teeth in an accident. And they grew back in. They were not late baby teeth. She had 2 sets of adult teeth. But just for the 2 front teeth. I thought my tears stinging like hot acid when crying was normal. And that feeling a pain in your nose when crying was normal. Apparently it's not. Conversation went something like this. Watching sad dog rescue video with sibling me. Oh no, I'm about to cry. I can feel the pain in my nose. Sibling? Question mark? Me. You know the pain in your nose when crying? Sibling. That's not normal. Me. PFFFT. And I guess tears feeling like acid isn't normal either? Silly. That's why you end up crying. Sibling. Comma. There's a condition people can have where they're essentially allergic to their own tears. Organ specific something or other. Well. A doctor listened to my heart and lungs the other day and asked if I was nervous. I said no and showed him my Fitbit data of a daytime resting heartbeat between 90 and 120 and yeah, it turns out I'm gonna need to get that checked out. Jesus. And here I get worried when my resting BPM is at 70. Cause that's 10 higher than usual. Edit. If anyone's curious. My BPM is normally 60. But it jumps to 65-70 when I go visit my mum. Love her. But damn does she stress me out. Not a doctor. A patient that thought periods were supposed to immobilize you and that you basically shat what looked like hair pulled out the shower drain out your vagina. Apparently I have blood clots and endometriosis. Had it since I was 11. This is the kind of stuff that should absolutely be part of school education. Patient here. Didn't know it wasn't normal for toenails to just hurt. You know. All the time. Ingrown toenails are a beach if you ignore them. My mother noticed my obviously infected big toes. Both of them. Holy shit. Doctor. TL. Doctor, don't let ingrown toenails get so bad they're going through your toe. Also learned that day that the way my toes grow, all 10 of those bastard appendages, are shaped in such a way that I can't have toenails without ingrown toenails. Ever. At all. Someday in the next few years I have to get the rest of my toenails removed. Might dig out the picture of the removed big toenails if there's interest. I have a sharp interest in not seeing that picture. I diagnose diabetes all the time. Many of my patients come in super sick. All have a history of drinking a lot and peeing a lot. But don't actually think it's a big deal until I ask and explain why people with diabetes pee so much. You just gave a heart attack to the entirety of our/hydro homies. Not a doctor. But have been a pincushion for about 20 years. I was shocked to find out that post-nasal drip is not normal. Migraines that make you blind for hours are not normal. A severe drop in blood pressure when going from sitting to standing isn't normal. And it's also unusual to stay conscious during a drop that big. Being able to pull your own shoulder halfway out of the socket is both abnormal and creepy to watch. And my mom and grandma told me it was normal that my bottom ribs can slide underneath the ones above them. Also, I was sitting in on my friend's appointment one day and he casually said that some things are just impossible. Like how no one can lick their elbows. I was very confused as I had never heard anyone say that was even rare. So I of course tried. I can lick my elbows. And yes, I have heard of and talked to my doctor about EDS. My hands are separately messed up. Though. So while I can touch my thumb to my wrist, my fingers do not bend back. If I try to bend them one at a time, they don't even extend normally. Pinky can do 90. But that's it. If I bend all 4 at once, they stay straight. I can't bend them at all. Also I can't have an IV for more than 2 days. Day 3 it collapses. Every time. I have scars from having so many IVs. What the heck is up with your connective tissues? All the comments sound like the ending credit of B99. Not a doctor. FRML on. I've learned that skin pain isn't normal. Like, when someone touches my skin, it feels like they're rubbing sandpaper on me. I thought everyone had that. I'm getting tested to figure out what it is. You might consider asking about fibromyalgia or looking into it some. I know people who deal with that, and when they're having a flare up, they can't stand people touching them, among other symptoms. I heard this from my elementary teacher. There was a kid in her class years ago. He kept moving in class and even keep dropping books and pencils around his table. Other kids couldn't concentrate. So she called his parents and told about him. The parents didn't believe her, saying she was framing their son. So she filmed what's happening in the class. However, the parents insisted that the teacher edited files, sending only bad moments. So she told them to come and see what's happening in her class. The mother saw and cried after class, saying she didn't know her son. Then the parents brought their son to a children's psychiatrist, and the psychiatrist surprised, asking how the parents could endure him. It was about a decade before the notion of ADHD became popular, and that time, saying others to bring their kid to a psychiatrist was the same as saying F letters to others in my country. As a teen with it, Duckman, this is really ducked. We can't help it. Ducking, like and subscribe.